Hello and welcome to yet another stop along the Mount Nittany Health 2020 virtual tour. Throughout our tour, we're taking you behind some of the scenes at some of the most high-tech advanced spaces across the health system. Today we're here with Christopher Kocher, MD, Mount Nittany Physician Group Cardiology. He's joining us from the Electrophysiology Lab at Mount Nittany Medical Center. Welcome, Dr. Kocher. Before we introduce you today, we're going to ask you to please remove your mask. While Dr. Kocher would normally be seen in his mask here on campus, today we will remove the mask in order for you to hear him better. Thank you. Dr. Kocher, let's start by introducing you. Tell us a little bit more about yourself and what you do here at Mount Nittany Health.
Well, first of all, thanks very much for having me. It's a pleasure to be here today and give you a tour of the EP spaces here at our new cardiovascular pavilion. I'm just one of a very talented group of physicians and cardiovascular specialists that we have here at Mount Nittany Medical Center. My practice involves general cardiology, most heart health problems, but I do have special training in electrical problems, cardiac rhythm abnormalities that we call clinical cardiovascular electrophysiology, or EP for short.
Very good. Thank you, Dr. Kocher. Can you tell us what services are provided in the space we're visiting today?
This is the EP Lab. We're very fortunate to have some generous community members and a foundation that's provided us with this brand new facility. This pavilion's been open for about a year. One of the spaces here is this brand new Electrophysiology Lab, or EP Lab. Here we do several procedures, deal with rhythm abnormalities, and that can involve things like minor surgeries for implantations of pacemakers, or more complicated procedures such as ablations or treatment of cardiac rhythm problems using catheters or other devices.
Okay, very good. Regarding electrophysiology studies, can you tell us exactly how those work?
Absolutely. We're lucky to have some of the most advanced equipment here at the new cardiovascular pavilion. An ablation, or what we call an EP study, is our way of evaluating the heart's conduction system. People can have various problems with the conduction system, oftentimes rhythms that go too fast or rhythms that go too slowly. They can provide symptoms, and in some cases can even be dangerous. An electrophysiology or EP study and ablation generally involves the placement of some catheters. We call them catheters, but they're really electrodes or wires. We have a few examples here. These are what we call catheters. These long wires, if you will, have electrodes on the end. And these are generally threaded through the veins or possibly even the arteries of the body with our X-ray camera. A portion of this room involves X-ray. This X-ray allows us to get the catheters exactly where we want them. Many of them are flexible and can be bent to provide information about certain areas of the heart. These catheters can also be used to produce a three-dimensional image of the chamber of interest. So in real time, we can use our advanced mapping system to produce a three-dimensional image of the heart, which guides our treatment and evaluation and allows us to pinpoint electrical problems and treat them oftentimes by burning away, cauterizing, what we call ablating, some abnormal electrical tissue. This is not a surgery. It's oftentimes an outpatient procedure. Many people will come in the morning, have the procedure performed, and be home for dinner. It's very safe and in many cases very effective for simple rhythm problems. Some of the most common rhythm problems we treat here, the effectiveness of an ablation is well over 90% for curing certain electrical issues.
Okay, very good. Are there other features that you'd like to show us today that are available here in this lab?
Absolutely. We're lucky, once again, to have the latest equipment, a brand new fluoroscopy system or X-ray system. The advantage of newer systems is that there's a lower dose of radiation administered to patients in order to achieve the same results. Once again, we have the advanced mapping system. This is some of the latest equipment that allows the procedure to be done more quickly and safer than some of the old ways that we used to approach rhythm problems. And of course, we have some of the latest technology when it comes to devices. So one of the things that we do here almost every day is implant pacemakers or defibrillators. These are devices that are designed to treat either very slow heartbeats or potentially deadly fast heartbeats. Some of you may be familiar with pacemakers and defibrillators. A pacemaker is a relatively small device that gets implanted surgically. It's a very minor procedure that's all done through a very small incision in the chest. A defibrillator is a slightly larger device. This is placed in the same fashion as a pacemaker, but serves a different purpose, requires a slightly larger device in order to provide life-saving treatment if necessary.
Okay, very good. Thank you, Dr. Kocher, for demonstrating that. You mentioned a lot about electrophysiology studies for those heart arrhythmia problems. Are there any other types of studies that can be ordered for patients besides those that are done in this space?
Absolutely. One of the big advantages to our new cardiovascular pavilion is the fact that we've been able to consolidate all of the cardiovascular tests and services that were previously done at different parts of the hospital or different places. So a patient can come to this cardiovascular pavilion. They can have a catheterization, which involves angiography, looking at the heart arteries. They can have cardioversion. A cardioversion is one way to return a person to a normal rhythm by delivering some electricity to the heart, done as an outpatient procedure. We have Holter monitors, which are daily heart monitors that people can wear in order to identify heart rhythm problems. We perform all of our stress testing here as well. Stress tests generally done to evaluate the need for more extensive evaluations of heart arteries, let's say, to look for what's commonly referred to as heart disease. And of course, just echocardiography as well. We have a talented team of echocardiographers, echocardiography being an ultrasound examination of the heart to look at the chamber sizes, dimensions, valves, things of that nature. So a full spectrum of cardiovascular tests available right here in one spot.
Wow, very good. Great to know that patients can take advantage of all those services in one location at the new cardiovascular pavilion right here at Mount Nittany Medical Center. Earlier in the video, you referenced heart arrhythmias, plural. Can you tell us what are the different types of arrhythmias that a patient can experience?
Oh, absolutely. There are a variety of heart rhythm problems, and we can discuss them in several different terms or categories, perhaps. One category of heart rhythm problem involves heartbeats that are too fast or heart rates that are too fast. We call these tachyarrhythmias. And a fast heartbeat can originate either in the top part of the heart, the atrium, or the bottom chamber of the heart, which we call the ventricle. Rhythm problems of this nature, which originate in the top part of the heart, we often call SVT, or supraventricular tachycardia, above the ventricle. These rhythms are generally not life-threatening, but can certainly impair a person's lifestyle and be very bothersome, and in some cases produce fairly serious symptoms. One of the more common rhythm problems that we see originating from the top chambers of the heart is atrial fibrillation. This is probably the most common electrical problem that we deal with these days, atrial fibrillation. We don't offer ablation for atrial fibrillation here, but certainly we have the means to evaluate patients with atrial fibrillation and provide other treatments for that rhythm problem. Other electrical problems that can generate rapid heartbeats oftentimes can be fixed right here in the Electrophysiology Lab. As I mentioned before, rapid heartbeats, while not deadly, can certainly be bothersome to patients, and ablation offers a very good success rate for treating these rhythm abnormalities permanently. Other more concerning electrical problems generally originate in the ventricle being the main pumping chamber of the heart. Rhythm problems such as ventricular tachycardia, very rapid beating of the bottom chamber, or more concerning, ventricular fibrillation, where the bottom chamber of the heart simply stops beating, can be treated with defibrillator therapy. So patients who are oftentimes at risk for these problems are treated by placing a defibrillator, which has the ability to fix these deadly arrhythmias and save a person's life in that circumstance.
Okay, very good, thank you.
We also treat slow heartbeats. Once again, many patients come in with heartbeats that are too fast, but also there's the possibility of a heartbeat that's too slow. The heart's conduction system simply does not keep up with a person in some circumstances. Oftentimes this is age-related, and for people who have a heartbeat that's too slow and it's bothersome or maybe not reliable, then a pacemaker is often indicated.
Very helpful, thank you. Dr. Kocher, what are the symptoms of an arrhythmia?
Some arrhythmias will produce no symptoms. Oftentimes we'll see patients with atrial fibrillation who are not even aware that they have atrial fibrillation. But more commonly, rhythm problems will produce symptoms such as dizziness, breathing trouble, perhaps passing out in some circumstances, and rarely chest pain. Commonly, people will also notice a certain irregularity in the heartbeat. We call that a palpitation. Some people refer to it as a flutter. These are the common symptoms of rhythm problems.
Okay, very good, thank you. Before we let you go, we do have a few viewer questions for you today. The first question is this: how long should you wait to see a doctor if you experience heart fluttering? Is an occasional episode safe?
I would say an occasional heart fluttering that's very quick and not associated with other symptoms is common. I think most of us at one point in our lives have probably noticed a slight irregularity in our heartbeat, and that does not pose a danger. That oftentimes can be mentioned to a primary doctor at a routine visit. If you're having a lot of these flutterings, or if they're associated with other symptoms, perhaps you want to make an appointment to talk to a doctor within a few weeks perhaps. There are concerning symptoms which may need to be addressed right away. So certainly dizziness, severe dizziness, passing out, chest pain, or significant breathing trouble associated with what you perceive to be fluttering or palpitations likely needs to be addressed right away. And that may even require an emergency room evaluation.
Okay, very good, thank you. Another question for you. What types of restrictions do you recommend for those wearing pacemakers?
A modern pacemaker is amazingly reliable and resilient. There generally are not many restrictions associated with use of a pacemaker these days. A pacemaker can undergo interference, or there can be some interference with a pacemaker if you're too close to a very strong electrical or magnetic field. These are not things you're likely to encounter on a routine day-to-day basis, but there are some hobbies which perhaps can be dangerous in association with a pacemaker, such as welding, arc welding in particular, or working on a running motor. Getting too close, let's say, to an alternator or spark plugs could produce some interference with either a pacemaker or a defibrillator, and we would discourage that. But as far as day-to-day activities, use of the arms, use of a telephone or a cell phone, there generally are not restrictions.
Okay, very good, thank you. We have two more questions for you today. The next question is a two-part question. It reads, can caffeine cause arrhythmias? And how much caffeine do you recommend as a safe amount in a day for a healthy person?
A very good question. Obviously, all of us like to enjoy a cup of coffee or tea on occasion, some more regularly than others. Studies have actually shown that caffeine, coffee consumption, do not predispose people to heart rhythm problems. Having said that, there definitely are some people who seem to be more sensitive to caffeine. I've certainly encountered patients who, if they drink more than their usual 2 cups of coffee in the morning, may notice more flutters during the course of the day. But these are not dangerous symptoms, and generally speaking, caffeine has not been associated with the development of any dangerous heart rhythm problems. If you're looking for a safe amount of coffee or caffeine to drink in a given day, I think most authorities would agree that less than 400 milligrams of caffeine a day is certainly safe. That equates to somewhere between 3 and 4 cups of coffee, keeping in mind a cup is about 8 ounces and not your venti latte with 4 shots of espresso. But I think overall studies have shown caffeine is very safe.
Okay, very good, thank you. Final question for you before we go. Are there any lifestyle changes that you found to be helpful in treating arrhythmias?
Absolutely. One of the more frustrating rhythm problems that we deal with is atrial fibrillation. We don't have a cure for atrial fibrillation. We have therapies that are very effective, and I would venture to say that most patients under our care eventually will come to the point where we have their atrial fibrillation controlled and they're quite happy. But what's recently been discovered is that certain lifestyle modifications oftentimes are just as effective as some of the more advanced therapies for atrial fibrillation. Certain things like mild weight loss, regular exercise, a healthy diet, oftentimes what we would call a Mediterranean diet, maintaining a good blood pressure, and treating other problems such as sleep apnea. Sleep apnea being a very common sleep disorder that has definitely been associated with atrial fibrillation. So I would venture to say that if patients take the initiative and exercise regularly, keep their alcohol consumption to a reasonable level, and can lose a little bit of weight, oftentimes we've done just as good a job themselves as we can do with all of our advanced technology and medications.
Very good. Thank you so much. Well, that's about all the time we have for today. Thank you, Dr. Kocher, for your time and your expertise being with us here today. And thank you, everyone, for watching. Please be sure to follow our Facebook page for our next virtual tour stop. And for more information about the services we featured today, please visit mountnittany.org.